Alrighty. This one didn't go as well because they had a paramedic involved, but they eventually got him back.
A man that collapsed on the floor, lifeless. They have mere minutes to save his life. And every moment he's not breathing, increase the chances that he'll have severe brain damage. Some of the very serious situation in times have the right rest, be unconscious, most breathless. A man's son-in-law tries to provide clues to what caused the collapse.
They were running their life. They were taking a rest on the grass. They were sitting on the grass, just went unconscious.
Lifeguards ready the AED. It could be the difference between life and death.
The key to saving people that are having heart attacks is early defibrillation. The AED, it runs an analysis and basically tells you whether the patient has a shock in the rhythm.
The shock failed to restart his heart. 5 meters of actual breathing. Those aren't actual breaths, it's just noise that's coming out of the windpipes. The patient is not actually breathing out of the lung. The man's chances of survival increase with every passing second. Time is running out. Paramedics have joined the efforts to save the life of a man in cardiac arrest.
He was unconscious on his oxygen. The patient is still pulseless and breathless, receiving respirations, feedback, dominance, and chest compressions. Still not very good skin color, but we're doing all we can.
The victim's anxious son-in-law attempts to reach family members who know the man's medical history. Any information can help the rescue team in this perilous situation. Paramedics administer drugs that could reset the man's heart.
Those are acting and looks like you just got one round of iodine on the order for you.
But the drugs have been one back. Again, his body reacts. His heart does not.
It appears at this time that he is sexually dead. He's not breathing and his heart is not working on its own. The challenge here is to get it back.
Precious seconds continue to pass as the man remains lifeless.
Constantly having 3 shots. Usually, if someone's going to come back, they're healthy, their heart's strong, they're going to come back pretty quick. And we got something right now showing it doesn't look so good.
Paramedics have delivered several shots. Performed CPR and injected medications to the man in cardiac arrest with no success. When suddenly, the man's heart restarts. The man is in need of advanced medical care.
That's perfect. We're seeking ventilation right now.
The victim is still unconscious, but now has a strong pulse.
We've got to continue to do everything we can to get back.
The endless effort of lifeguards and paramedics has resulted in a miraculous recovery.
Any questions? All right, I got one more for you guys to watch. Sure, how long it is. Pretty interesting. This is what I just added recently. That's 45 minutes. You guys can watch it on your own time. A little bit. So,
Breathing right. Yeah, keep going.
Ready, 1, 3, right, 1, 2, 3. Go ahead.
Connected and electrodes.
Okay. How are you? Can we just, 3, 1, 2, 3.
Connector and electrode.
You got 3 charges on that?
Just connected and electrode.
We bagging and all that? Look at I do. You do the right one? Okay, cool.
30 seconds. Yeah. Alright, gonna pre-charge.
I got it, I'll do it. I'll do it. Keep going.
Alright, we're gonna check in 5 seconds, y'all. 3, 2, 1. Alright, 12 seconds. Yeah, okay. Keep it clear. Alright, stop. Taco's looking good. Good 41 now.
You swap it out with me.
30 more seconds of compression so next full check. Alright, ready to pre-charge. Keep going.
Ready to swap out process.
5, 4, 3, 2, 1. Full check.
You want to beat him again?
Yeah, that's it.
Back on CPR.
Back on check.
Amnio's going in. 300 for the amnio. Yes.
Oh, wait, we'll keep doing CPR.
Immediate change.
Amnio flushing perfectly.
Alright, good. We'll hang it around at the end too.
Perfect.
She's trying to do a little husband. You're in Travis. She said it's hard.
That's an interosseous situation, it rolled into the boat, the cops are off to get an ID.
I'm not feeling very close to, yeah, you're in college, jump that a little bit.
Yeah. About 50 seconds till next post check.
We're forming nicely.
Alright, 50.
Shit, I got a pulse right there.
They mark the roll
Yeah,
first,
sure.
rules on the Sharpie, so they don't play around.
I couldn't feel it earlier, I think that should
Yeah.
have.
Alright,
Alright, we have dashboard, we have structure and outside.
alright, 30 seconds until next post check.
So he's feeling for a false pulse on the femoral artery, to make sure they're doing compressions correctly and getting blood flow.
Alright, 15 seconds. Recharging, keep going. 5, 4, 3, 2, 1. Post check.
Yeah.
Pulse, alright.
My pressure is sad.
Pulse.
Monthly respiration still goes.
So you have return to spontaneous circulation. Not bad, any questions?
Yeah,
Yeah,
when would they have decided to just like get out and go move with her if they couldn't have made?
most protocols, unless you have mechanical CPR, you don't move until you did or given up or gotten the pulse back.
So you would give up eventually if it didn't come back?
Depends on what your protocols are.
Okay,
Usually after 4 rounds of advanced life support, if they don't get them back, they stop it now.
okay.
Unless it's traumatic, then traumatic you go, so you need to get to a surgeon. Because it's usually from bleeding instead of cardiac. Any questions? Any other questions? Good question. All right, we got a 35-year-old mildly obese woman who has right upper quadrant pain, referring to her right shoulder. This pain is most likely caused by what? What?
Spleen.
No, spin's left.
Liver.
Gallstones are right. Live up. Acute cystitis, cholecystitis, appendicitis, pancreatitis. Acute cystitis. Interesting. I didn't write that one. 59-year-old male presents with sudden onset of severe lower back pain. He's consular but very restless and diaphoretic. And he's got a pulsating mass to the left of his umbilicus. Those are all the signs and symptoms of an abdominal aortic aneurysm. Also a car insurance company, AAA. Which one's the best answer? Do we vigorously palpate the abdomen so we can rupture the aneurysm? No. Do we give oxygen for immediate transport? Better answer than A? Absolutely. Put him in a sitting position, transport at once. Good answers. As good of an answer as B? No. Just paramedic, give the pain medication. That's not going to save him. What's the best answer? 47-year-old male presents severe abdominal pain 3 hours. Abdomen is distended and guarded. Your most important consideration should be to no. That's a good answer. Better answer than A. Good answer. Better answer than B. No. Not a bad answer. As good of an answer as B.
No.
All right, which of the following is a late sign of shock? That's a good answer. That's a good answer, but is it a better answer than A? Because you have that compensated also. That's also a good answer, but is as good of an answer as A? No. Also a good answer, but you also get that in compensated shock. So what's your best answer? A. All right, let's learn about neurological injuries, emergencies. Let's learn how Brian needs to learn how to talk. Thoughts for the day. The best of the best in this world cannot save anyone alone. You have to work cohesively as a team. be supportive of your team. Your team will only be as strong as its weakest link. The more you help strengthen that weakest link, the better you and your team will become. Any questions? All right, so what are we gonna learn about tonight? Tonight, we will learn about the anatomy of the neurological system, the function and physiology of it, the types of neurological emergencies, being able to list the signs and symptoms of each neurological emergency, and the treatments based on the signs and symptoms, what type of assessment or what type of treatment we will do. This is the central nervous system, the brain and the spinal cord. Any questions? That is your brain on labels. Any questions? So the three parts of your central nervous system are the cerebrum, the cerebellum, and the spinal cord, which includes the medulla oblongata, also known as the brain stem, unless you're an alligator. Or crocodile. Alligator. Huh? It's an alligator. They don't have crocodiles in Louisiana. Any questions? There's a cerebrum in living color. Gives you an idea of where those neurons are located at different control centers. So there will be test questions on this. Your cerebrum's got a right side and a left side that's cross-wired. So if you're left-brained, you're right-handed. Your right brain, you're left-handed. So if you stroke out your right brain, the tissue dies. A stroke is a brain attack. So think of a heart attack, but it's your brain. Dead tissue in your brain. So if the right side of your brain dies, you'll lose function of the left side of your body. Make sense? And generally, speech is on the left side too. Any questions? And the cerebellum is a little golf ball sitting at the base of your brain. What's there? Nothing important, just attention, language, emotion, fear, pleasure, sensory, motor function, other stuff. I don't want that part to impart. Don't have any questions. And then the brain stem. Controls your breathing, not important. Heart rate, vomiting, temperature, minor stuff. Any questions? All right, so here's what the neurological emergency is going to go over. Headaches. Generally are not life threatening, but can be. Strokes, which is death of brain tissue. Seizures, which is like ventricular fibrillation of the brain. And your most common call you'll probably be called to altered mental status. And we're gonna go over the different causes and reasons. So your three main types of headaches are migraines, tensions, and clusters. None of them are fun. We're gonna go over each one of them. Migraines is the second most common, tension is the most common. It's very poorly understood. They really don't understand the etiology of it, which means the causes. They know there are links to procedures, but not direct associations. Usually pounding, throbbing, pulsating, they have a lot of different theories and thoughts on what causes them. It's very possible that it's multiple different etiologies depending on the patient. It lasts from hours to several days. No known cure. There are some medications that help, but nothing that's really been able to fix it. Any questions? Tension headache's the most common, which is funny because it usually comes from the tense muscles in your neck and back, which then radiate, refer the pain to the head. Generally a squeezing, dull, generalized ache. Generally associated with stress. And sinus, these things suck. Also, this cluster headache usually caused by allergies, hay fevers, get pockets of pus and stuff inside your sinuses. Extremely painful. Usually relieved with antihistamines and vasoconstrictors like Sudafed. Any questions? So, rare occasions, headaches can be the first signs of hemorrhagic stroke, such as what's called a thunderclap headache, which is a sudden, severe, debilitating headache. Pain brewers, also known as brain tumors. And of course, meningitis, which is kidding also. Those could be fatal, so never just rule it out as, it's just a. Any questions? All right, let's go to what a stroke is. The medical name for a stroke, medical terminology, is a cerebral vascular accident, abbreviated CVA. That's what we call it in medical terms. And it's any type of interruption of blood flow to the brain. So there's three different types. And for the testing, there'll probably only be two. There's ischemic, which is 4 out of 5. 80%, and then there's hemorrhagic, which is 1 out of 5. And then there's also hypoxic, which they don't really list for testing, which is anoxic brain injury, lack of oxygen going to the brain, like not breathing. They're not having a pulse routine. So what happens when there's a cerebral vascular accident? The brain cells die from lack of blood flow. Of course, they're dead, the brain doesn't function. And once they're dead, there's no coming back. Any questions? Good news is you as EMTs can do assessments, recognize the signs, symptoms, get a good timeline, and hopefully get them into a stroke receiving center that can stop the stroke in its tracks, and return them to full function. Now, there's only 2 types of strokes on here because the transischemic attack is not a type of stroke, it's stroke mimic. So ischemic, which is 80%, hemorrhagic, which is 20%. For some reason, they list transischemic attack. I don't know why they do it that way, but that is a stroke mimic. It's like angina of a stroke. It's all the signs and symptoms of a stroke, but the brain cells don't actually die. And with rested oxygen, they return to normal function. also abbreviated as a TIA. Any questions? That will be one of the test questions on what other types of brain mimics, stroke mimics. Like TIA is one. There's two others which will go over for the selection. So, any questions? So ischemic strokes are the most common. It's when a blood clot breaks off from somewhere else in the body, just like with a heart attack. But instead of going into a coronary artery, it goes into a cerebral artery, and everything distal to where that clot lodges dies. Arteriosclerosis is the most common culprit that causes that. Any questions? And depending on how many clots break free or how large the clot is, it may be mild symptoms to severe symptoms to death. Any questions? Great picture. Any questions? So generally the left hemisphere stroke, there's a vocabulary word you must know, aphasia. That's when you're unable to speak or understand speech. If it's receptive aphasia, it means you can speak, but you don't understand what's being said to you. And there's expressive aphasia, which means you understand what's being said, but you can't get the words out. Any questions? Then right hemisphere is definitely usually dysarthria, which is you think that you're speaking okay, which is actually dysphagia. But when you talk, you hear a blah, 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 blah when you talk. But to you, that sounds like, oh, someone please let the dog out. But what you're actually saying is just garbled words. Any questions? And they generally don't even know they're doing. So other signs and symptoms of stroke, paralysis to one side of the body, or weakness to one side of the body, sacral, syncope, facial drooping, sudden weakness or numbness, loss of muscle coordination, a headache, or altered level of consciousness. So if we have any suspicion someone's having a stroke, we have to act quickly. First thing you have to do with EMP is get a timeline. You need to know the last known moment. When was the last time they were without these symptoms? Critically important. And the second thing you need to do is a 3-step test called the Cincinnati Pre-Hospital Stroke Screen. What you'll do is you'll have them hold their arm straight out in front of them like a monkey. And if they have an arm grip, that's a possible sign. It's a positive sign. If they don't, then it's negative. Next thing you do is say, give me a grip and show me your teeth. Like this. You look at all their facial muscles. They have a droop, that's a positive sign. If they don't, that's negative. When you ask them to speak a sentence with lots of vowels and syllables, like the sky is always blue in Cincinnati, it's the common one. If they can say that clearly, it's negative. If they slur their speech, it's positive. If they have all three of those signs are positive, it's a 90% chance they're having an ischemic stroke. So, if you can get the drug TPA on board within 90 minutes of the last known normal time, they have an excellent chance to have a 100% recovery. If you don't, they're likely going to spend the rest of their life in a nursing home or severely disabled. That's not easy because it's not from the time you get there. It's like trauma and like a heart attack. It's not from the time you get there. It's from the time of onset. You got to get there. You got to notice the signs and symptoms, do the right assessment, recognize it, call a stroke alert, get them to a stroke receiving facility. Just like cardiac and just like trauma, they've got to have heads up so they can get the CAT scan cleared, get their people cleared, get the drugs ready. They've got to go in, then they've got to assess them. They have to do a 2-page rule out before they give the anti-clot busting drug. Because if they give it and there's one thing positive on their 2-page rule out, they die from the drug. Because it dissolves every clot in your body. So any small bleed becomes a massive hemorrhage. And they got to do a CAT scan and make sure it's not a hemorrhagic stroke. So you give this drug to a hemorrhagic stroke, it's over 100% of the time, dead. Anyway, and then when they get out of the CAT scan, if everything, the 2-page list is negative, it's still within 90 minutes. And the CAT scan's not, shows it's not a hemorrhagic stroke, they can give the drug. It's in 90 minutes, they generally have 100% recovery. That's pretty hard to do. Any questions? But it is doable, yes.
What closest like stroke response?
Mount Shasta and Wairika are both STEMI or stroke receiving facilities.
Oh, okay.
They're fully set up and capable. If you give them a lead time. Any questions? All right, you call a stroke alert in the field. When you hit the ER, they don't even stop the ER. You go straight to CT scan. They go straight into the scanner. Make sure it's not a brain bleed. Do the rule out while they're in the CT scanner, this 2-page list. And as soon as they come out of the scanner, they hit them with the drug. Any questions? Drug is TPA. I can't remember what it means. Transmedic plasma activated. Transtitial. Any questions? So it's not easy to sound. First stroke's got to recognize. People generally don't call 911 right away. Denial is a lot more than a river in Egypt. Someone's got to recognize, someone's got to call 911, but it's got to go through the full PSAP dispatch system, which is usually about 7 minutes. Then you got to staff your apparatus to respond and get to scene, 8 to 10 minutes. Now we're already 15 minutes into it if somebody called right away. Then you got to get them loaded up. Say you're really, really good, you do it in under 10 minutes. Now you're at 25 minutes. And the average transport time in most areas that aren't super rural like here is 8 to 10 minutes. Now you're at 33 to 35 minutes, which leaves you only a window of 25 minutes to get them in the CAT scan, do the rule out, and give the drug. Now 90 minutes, gives you 55 minutes. But anyway, there's a lot to go wrong there. Everything has to go right. Any questions? Any questions on how to do the Cincinnati pre-hospital stroke screen? Any questions? Yeah, if you're not at stroke center within an hour, they're not going to get the drug on board in 90 minutes. It's going to take at least 30 minutes to get the CAT scan, get the drugs mixed, and all that, do the rule outs. Any questions? All right, here's something I hope you'll really like. No audio. There it goes. Well, thunk. Any questions? Maybe this is better.
Watch what magnesium does to your bowels.
If you have to wipe a million times after you poop, here's why.
The Mayo Clinic confirms it.
Wow. We're getting to that. Abdominal emergencies.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via 2 major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke.
Any questions? So a titrate O2 to 94%. Keep the head of the gurney elevated at least 30 degrees if you can. And again, early notification to a stroke receiving center and getting them there as quickly as possible. Earlier notification, the better chance to grab their CAT scan cleared and everybody ready. Yes.
So you asked them the three things to put their arms out, to grin, and then what was the sentence you'd ask them?
The sky's always blue in Cincinnati.
Is the sky always blue in Cincinnati?
Yeah.
Okay.
Any sentence will work though. All right, here's the TPA commercial. Then we'll go to break.
Activase, also known as recombinant tissue plasminogen activator, or
Yeah, that was
TPA,
it.
is the only drug approved by the FDA for treatment of stroke. Growing plaque can rupture, promoting thrombus formation by activating the coagulation cascade. Platelets and red blood cells aggregate at the site of injury, causing further narrowing of the artery. This impedes blood flow even more and causes turbulence in the artery. It also increases the likelihood of thrombus formation. As the thrombus grows, it causes increased vessel narrowing, leading to partial or even complete occlusion. The occluded artery leads to ischemia and tissue necrosis. When a piece of thrombus breaks off, it's called an embolus as it travels up the artery. During a stroke, ischemia can progress to infarction. Beyond the infarction lies still viable tissue called the penumbra. Cells within the penumbra are potentially salvageable if blood flow and vital oxygen are restored promptly. The penumbra is the focus of fibrinolytic treatment. Now let's look at the thrombus itself. Inside the thrombus are strands of fibrin, the protein that forms a clot. Enmeshed within the fibrin is plasminogen, the inactive precursor of plasma. Activase is administered by IV infusion within 3 hours of acute ischemic stroke symptom onset. Activase binds to the fibrin in a thrombus and converts plasminogen to plasma. Plasmin then breaks the strands of fibrin and dissolves the clot. As the clot dissolves, blood flow is restored, and viable tissue may be reperfused. Although the original infarction remains, when surrounding cells in the penumbra are saved or reperfused, function may be restored. Activase, the one TPA for stroke, is the only drug approved by the FDA for this indication. Activase is indicated for the management of acute.
Blah, blah, blah. We'll watch one more. This is a quick one.
Treatment of acute ischemic stroke with clot retrieval device.
This they can do this under interventional radiology.
Ischemic stroke is a condition in which normal blood flow to the brain becomes interrupted. When a clot becomes lodged in one of the arteries that supplies blood to part of the brain, the tissue is deprived of oxygen. Clot removal devices are designed to treat ischemic stroke by removing a blood clot from the artery. The clot removal procedure begins by advancing a guide wire through the blood clot within the artery. A microcatheter is advanced along the guide wire until it is beyond the clot. The guide wire is retracted and the clot retrieval device is advanced through the microcatheter and deployed as the microcatheter is retracted. Once unsheathed, the device expands, pushing the clot to the walls of the artery and immediately restoring partial blood flow. Over the next 2 to 5 minutes, the device becomes embedded in the clot. The clot retrieval device, along with the blood clot and microcatheter, are removed from the body. Blood flow is restored and verified with imaging. The entire procedure typically takes less than an hour.
All right, go to break, be back at 8 o'clock, and go to times. Plasmic activator.